Miscarriage is a group of conditions where a woman falls pregnant. Usually the pregnancy is in the correct place within the womb, however the pregnancy doesn't continue. So commonly a woman would come having thought she was pregnant, having done a pregnancy test because she'd missed a period, found it to be positive, and then had some bleeding. We would investigate that clinical situation with an ultrasound, and the ultrasound in a miscarriage would show perhaps a sac with no fetus inside, or a sac and a fetus smaller than we would expect from the number of weeks since her missed period, and no heartbeat in the fetus. And this would be what's called a missed miscarriage or an incomplete miscarriage.
It depends on the gestation as to how the miscarriage occurs. If it's very early, sometimes a woman won't even hardly lose any blood or anything because the body reabsorbs the pregnancy. And I've known women of 8 weeks who have miscarried and, as I say, basically haven't lost hardly anything. As the pregnancy progresses, there's more likely to be more blood loss, and you may see something formed, depending on how far along you are.
With the first one, it was a bit of a shock because I didn't even know I was pregnant. I just started bleeding majorly and stomach pains and just thought I was dying, basically. And I went to hospital and they said, "Oh, you're losing the baby." And I was like, "Oh, what baby?" It was a bit surreal.
I've had quite a few miscarriages, 4 or 5 in the past, and they've all been before 6 weeks pregnancy, so I'm only just pregnant.
I don't always advise women to go to hospitals because the vast majority of the time the body will deal with it perfectly all right on its own, and weigh that up against having an invasive procedure in a hospital. And we have learnt that the instruments used to scrape out uteruses have done more damage than what the miscarriage could potentially do.
15 years ago, almost every woman who was in that situation opted to have a D&C operation, which is a stretching of the neck of the womb and a gentle scrape of the lining to remove the pregnancy tissue, particularly to remove the placenta. However, now we know that if people don't undergo the surgical option, most of them tend to complete their miscarriage as a heavy-ish period, sometimes quite a heavy period, which a woman would have to be prepared for. But usually the pregnancy sac and its contents would come out amongst some blood clot, and the woman escapes surgery that way, and any complications in relation to surgery. And now I would say approximately 50% of women wish to be managed conservatively.
I had a D&C with the first one because it was so far on, but the others have all been about 8-9 weeks, and I haven't needed a D&C then.
So again, let nature take its course. In the vast majority of cases it'll be fine, as long as the bleeding ceases after the miscarriage, as long as there's not a foul smell to any discharge that's left after the miscarriage, as long as there's not any increase in temperature and some other signs of infection, then probably the body has dealt with it perfectly okay.
There are some medications which are similar to the medications we use for inducing labour, which can be used to speed the onset of miscarriage, but they're not in wide use throughout the country yet, and to an extent they're still being trialled for their effectiveness and their safety. But it may well be that a little bit along the lines of medical termination of pregnancy, that some of those medications may be routinely used in miscarriage in the future.
Miscarriage can also cause great emotional pain.
Miscarriage is a strange thing to happen because your hormones are all over the place, aren't they? And you're really happy and excited because you're pregnant, and your body still thinks it's pregnant, but you've actually lost the baby. It's a really head-confusing time.
With the other miscarriages, I've been lucky that they haven't been, well, lucky is a relative term. I've been lucky that I've not had any pain, I've just had bleeding. So it was, sad, but it happens.
And with each of my miscarriages, it's been horrible, it's been traumatic, but I've accepted it, and that's been okay. I just feel with each of my miscarriages, there was a reason for that baby going. And I'm fine about those, actually. I don't have a problem with them. I think because I have got 2 beautiful, healthy, happy children, you can accept those.
As 25% of all pregnancies end in miscarriage, it's not that uncommon and shouldn't affect your chances of conceiving again.
If the body's meant to get pregnant, it will get pregnant. I don't think there's any evidence to say you should wait 6 months, 3 months, 1 year, or whatever. A woman's body is designed to experience pregnancy, and it all comes down to how she feels. If she feels she wants to try the next month, if she gets pregnant, the chances are it'll be a very normal pregnancy. If she wants to give her body a few months to get well, get over it psychologically, that's fine too. So again, it's all about the individual woman, how she feels.
For Victoria, although having a miscarriage was traumatic, it didn't affect her future pregnancies, and young Esme is the latest addition to the family. However, there are a few women who will have recurrent miscarriages, and there are numerous causes for this which should be investigated by your gynaecologist.